The patients that I recommend this brush for are patients that have more difficulty. So any perio patients, so anybody with bleeding gums, anybody who has a little bit more of a difficulty in adapting a manual toothbrush, crowns, bridges. It's absolutely phenomenal for implants and actually use with braces, as these fine filaments and these tapered filaments of the brush head actually reach into these very difficult areas easier. What's really important for you though is to spend time with your patient and teach them how to use this technology. You cannot use it like a normal toothbrush, and most patients, as we know, take 30 seconds and brush their teeth really strongly like this. You've got to actually show them how to use it, hold their hand, and demonstrate on them, as you will see in this next section of this video of how I demonstrate it with my patient. One of the most important things that I do with my treatments is work on home care with the patients. So I'm going to show you and demonstrate how I work with the patient at the very end of any treatment, whether it's a prophylaxis, a pre-perio treatment, or in the perio sessions of therapy. Then I always go over the home care with them at the end, so it's fresh in their mind, so they'll know what to do when they go home to take what we've just done and sustain it. Okay, so we've just done your cleaning, okay, and I'd like you now to show me how you brush your teeth. Okay, so here's a mirror. So show me what you do and how you do it. So you're using a hand toothbrush. Okay, great. Go ahead. So brushing the tops of your teeth. Okay, great. Do you always start on the lower? Okay. Then you're going around. Okay. So you do it with your teeth together. You bite together. Okay, and then you're doing that one. Okay. And how are you doing the insides? Okay. So great. What's really important is to make sure you watch the patient brush all the way through their entire mouth. This will give you knowledge on what they're doing wrong, and it'll be easier for you to correct it and teach them how to do it right. Okay, great. So what I could tell is you were brushing your teeth, most of your teeth, but not your gums. Okay, and so remember when I showed you this flip chart? Remember that the plaque goes underneath the gums, and this is where the infection is coming and where the bleeding gums are coming. Okay, and I've showed you where those red circles are on under your teeth, where the infection is, where the inflammation is. So what you have to do is you have to think, I need to brush my gums, or more focused in this area where the gums meet the teeth, this pocket area. At the moment, you're actually blushing like you're 12 years old. Okay, that's it. Everybody does it. Don't worry about it. So we need to move you into adult brushing, not child brushing. Okay, so you're holding the brush really good. You want to hold it like, flute. Okay, now look in the mirror, and what's really important for you to do is I want you to always start in the back and work your way forward. Okay, so you're going to angle it into this direction, and then you're going to do small circles. Okay, and then you're going to come around like this, about 5 seconds per tooth. Okay, see how that feels to you. Very good. Now working with a manual brush it's okay, but it's not going to do the best job that it can. What we have nowadays are electric toothbrushes, and there are different technologies of electric toothbrushes. The one that I recommend, and I think this would be the fantastic brush for you, is called the Edel+White, and it's a very, very soft brush head, and it works with sonic technology. So that means works with the way that it swings, that's called an amplitude, and then the frequency of it. So it goes really fast, and it creates kind of a bubbles when it mixes with the saliva in your mouth. You can actually feel it, a little air on your hand. Okay, and these bubbles smash into these colonies of bacteria that are hidden under your gums and in between your teeth, and it helps you to break them away quicker. Okay, so let's go ahead and practice how you're going to work with this brush. Okay, so go ahead and look in the mirror, and what you're going to do is, remember, you want to start in the back and work your way forward. We want to get you on a system of brushing. Okay, and so you're going to take this, hold it like a flute, that's perfect, and you're going to go all the way in the back, You're going to angle it towards your gums like this, and then you're going to turn it on. It's going to go back and forth. It'll tickle a little bit at the beginning, but you'll be fine. And then you're going to gently kind of move it. So 1, 2, 3, 4, 5, and then you start moving to the next teeth. Can you feel that getting on your gums? So you want to brush your gums and the teeth at the same time. You're trying to get into that pocket area and get all of that plaque out of there. And then you will find that your gums will start to tighten up. You might notice that you're going to have some bleeding gums at the beginning, but that means the bristles are getting in there. You've done nothing wrong. Most people think if their gums bleed, they've done something wrong. It's actually, if you see the bleeding, get in there some more, because it's going to help to get the bacteria out so the gums can heal. Now, to do the top, inside, the inside's a little bit different, because that's where most people have problems brushing because of your tongue. So make sure you always take the brush in from the angle where your nose is. You're going to go to the back. You're going to lift it up a little bit to just use the top part of the brush, and then you're going to turn it on, and you can feel it and kind of push down on your tongue a little bit. Can you feel that down in there on the gums? That's what you want to feel. You want to feel like you're brushing your gums in there. There you go. Excellent. Excellent. And then bring it around, and as you come around the front, you're going to lift up on it. Exactly. You don't want to do it sideways because it's round, and if you do it sideways, you're going to miss it. So you're going to do it up and down like this. There you go. Feel good? Okay, now go, keep going further back. Yeah, and you start from the back and then work forward on that one. What you should feel is you should definitely feel those fibers going into your gums. Fantastic. Fantastic. It's good. Okay. Go ahead and turn it off. So what do you think? What are you feeling with it?
It was amazing. It tickles, but it's getting really deep in the gums.
You can feel it in the gums, yeah. Now some people might have a sensitivity to it at the beginning because you're not used to brushing your gums. That's why they might bleed a little bit and they might be a little bit sensitive. But it means the brush is really working, okay? Let's practice the top. So for the top, now the most important thing is most people open real wide, and that means you can't get the brush in there. You need to close your jaw and then slide your brush. Exactly. You want to loosen this area. So by closing, not all the way tight, but just closing a little bit, you can even slide your jaw sideways. There you go. And then you can get the brush back to that very last tooth there. If you can feel that back there now, you can try it without turning it on. Feel how that feels? Now you're going to turn it on. With this, and see, you don't have to do circles, you don't have to do anything. You're guiding the brush along your gums. Perfect. And then at the very end, you can do over the chewing surfaces if you want. Get up into your gums a little bit more. Feel that into the gums. Very good. Very good. Excellent. Right. Start in the back and work forward. That's perfect. That's perfect. You can hear how it's kind of hitting the teeth a little bit. Yeah, you'll get used to that. I mean, you'll stop doing that once you get used to the brush. Once you get learning the angles, everything about a sonic technology brush is about angulation and using it properly. Very, very good. Very good. And for the inside, same thing. Remember to slant it up into the gums. You're actually getting that border of the gums and the teeth together. Feel it? Yeah, it's going to tickle. It's going to tickle a little bit. And as you come around the front, you're going to tilt it down a little bit because you want to use that brush straight up and down like that. Exactly, that's because of the movement of the brush, it's going to get back of your teeth to get them cleaner. And I know you mentioned that you said sometimes you feel like you're not getting that area clean. This will help because of the movement of the brush. If you tried to use the brush sideways like this, you would miss it. That looks really, really good. So it's really important when you're working with your patients to spend at least 10 minutes with them at the end of your appointment to explain how to do this. With taking a little bit more time with them and helping them understand why they need to brush and how they need to brush, and actually holding their hand and showing them, you will achieve better compliance.